Hello, good evening all, and thank you organization team for giving me this opportunity. Can I share my screen?
Sure, ma'am.
Is this visible?
Yes, ma'am. Very
Okay. So once again, thank you to Dr. Asim, Dr. Chan sir, for giving this opportunity. As in previous session, we have already discussed about the role of immunotherapy combination either with immunotherapy or TKIs. So I'll be discussing on the consistency in efficacy of Pazopanib across clinical trials and real world setting. This session is sponsored by Novartis. So the study principle, a prospective observational study of real-world treatment patterns and treatment outcomes in patients with advanced or metastatic renal cell carcinoma receiving Votrient. So generally we see in any clinical trial, we have very narrow window on a broad population. We use very stringent inclusion criteria and we do studies in specialized environment. So this result can be applied on the real world population? So this answer of Votrient was given by the population study. As we all know that Votrient has already proven its efficacy and safety in a variety of randomized controlled trials as COMPAS or PICES. So they have a good experience in the number of patients along the across the globe. So in many countries, we are using it and we have efficacy as well as the safety. So to better understand the effect of treatment on patients, generally exclude from the clinical trials are brain metastasis or non-clear cell histology or poor performance status. So in this study, principal study, the NCT patient profile means non-clinical trial eligible were mild comorbidities, severe comorbidities, and KFE score of 60%, any symptomatic patient, the obese patient, and the lung metastasis patient with no prior therapy for metastatic RCC. Coming to the study design, so patient with advanced RCC, they divided into two, treatment naive and the cytokine pre-treated. So these are the exclusion criteria. Patients should not be on any other clinical trial. What were the principal primary and secondary goals? So overall survival, progression-free survival, and the overall response rate was primary goal, and the secondary were clinical effectiveness, safety, and relative dose intensity in patient with comparable baseline characteristics to those included in the phase 3 COMPAS trial. So if we apply all the eligibility criteria that were present in COMPAS, only 15% of the general population can be included in this trial. But in principal trial, there were no strict criteria. So this study reflects the real world population response as well as the efficacy. So coming to the result, if you see the median PFS, it is 10.3 and 10.7 in treatment naive patient. Overall, it was 10.3. If we talk about overall survival, the median overall survival was 29.9 months and 30.5 months in treatment naive patients. Coming to overall response rate, it is almost 30%, giving median duration of response is 11 months and median TTR in months are 3. And this is the efficacy regardless of age. If the patient population is less than 65, then we can expect 11.6 months. If more than 65, then 9.9 months, giving median OS of 34 months in less than 65 years old population group, and more, and it's around 26 months more than 65 years. So this is the efficacy according to the subgroups. In favorable, it is 25 months, in intermediate is 11 months, and the least in the poor, which is 4.2 months. And if we talk about the overall survival, it is not reached in favorable, it is 34 in intermediate and 9.6 in poor. So now if we divide according to the PS status of the patient, if the patient is 0, 1, 2, then it's 11.2 months. And if it is more than 2, it is 2.8 months. And if we see the median OS, it is 34 months in the first group and the 5.5 months in the patient who had PS of more than 2. So this is the comparable efficacy in CT versus NCT population. So in CT means clinical trial population, the median PF was 9.6 In non-clinical, it's almost comparable, 10.7 months, rather more. And median OS is 26.3, and the median OS in the NCT population was 33 months. Now coming to the subgroups, according to brain metastasis, if brain metastasis is present, then it is 5.6 months, and it's almost double those who did not have brain metastasis. The overall survival is also the similar. It's 11 months in the brain metastasis group, and it is almost 30 months in non-brain metastasis group. If we similarly in bone metastasis also, the overall PFS and OS were more in non-bone metastasis group. Coming to the safety profile, as we all know that with Pazopanib, we mostly see hypertension, diarrhea, increase in liver enzymes. So most common side effects were the hypertension, diarrhea, and the rise in the ALT and AST. Similarly, here also in principal trial, almost 74% patient had any grade of adverse events, while 23% was hypertension, 13% was diarrhea, and ALT was 11%. If we see in the trial phase, trial study, it is almost 40%. More than 1/3 patient had hypertension, almost half of the patient had diarrhea, almost half of the patient shown elevation in the liver enzyme group. So the results in real world patients, the key efficacy endpoints for the first line metastatic RCC patient, it is giving us PFS of around a year, and the median overall survival is 2.5 years with the response rate of 32%. So principal study confirms real world efficacy and safety of Votrient. It has already proven its efficacy. Results we have already discussed, and it is well characterized a safe drug while using in our clinics. Thank you.
Thank you, ma'am. Thank you so much for your excellent presentation. And next